The tonsils act as filters, trapping germs that could otherwise enter the airway and cause infection. They also make antibodies to fight infections in the body. What happens when the tonsils are inflamed or they get infected? Come along with me, let's explore this topic together. Hello everyone, it's your next door nurse Florence and you're welcome back to my channel where we talk about health and wellness in its totality. If you haven't subscribed, kindly subscribe, like and share. Thank you. Tonsillitis is the inflammation or infection of the tonsils in the upper part of the throat. Tonsils are the two lymph nodes located on each side of the back of the throat. They function as a defense mechanism and help prevent the body from getting an infection. Tonsillitis can occur at any age and it is a common childhood illness. Tonsillitis is contagious. It is spread between people through the air, and the bacteria that causes tonsillitis is group A Streptococcus. Tonsillitis is most commonly caused by a viral infection. Some of the viruses that causes tonsillitis include adenovirus, influenza virus, parainfluenza virus, herpes simplex virus. There are other types as well. Viral infection that causes tonsillitis passes on their own, but when caused by a bacteria, it is referred to as strep throat. Strep throat is a bacterial infection that causes inflammation and pain in the throat. Tonsillitis caused by strep throat can lead to serious complications if left untreated. There are three types of tonsillitis. We have the acute, the chronic, and the recurrent. In acute tonsillitis, the symptoms last around 10 days or less. It is more often a viral infection, which will likely improve with home treatment. In chronic tonsillitis, the symptoms continue longer than 10 days, or this is when you have a long-term tonsil infection. In recurrent tonsillitis, like the name implies, the individual gets it several times in a year. A tonsillectomy, that's the surgical removal of the tonsils, may be recommended for people that have chronic and recurrent tonsillitis. The possible symptoms of tonsillitis include a very sore throat, difficulty or pain while swallowing, halitosis, that's bad breath, fever, chills, a scratchy sounding voice, ear aches, headaches, stomach aches, a stiff neck, painful blisters or ulcers in the throat, jaw and neck tenderness from swollen lymph nodes, tonsils that appear red and swollen, and tonsils that have white or yellow spots. In young children, one may notice increased irritability, fatigue, poor appetite, or excessive drooling. Complications usually happen only if bacteria caused the infection. Some of the complications include a collection of pus around the tonsils, that's peritonsillar abscess, breathing problem or breathing that stops and starts while sleeping, that's obstructive sleep apnea, middle ear infection, tonsillar cellulitis, or infection that spreads and deeply penetrates nearby tissues. If the streptococcal infection or the strep infection is not treated, it could lead to more serious problems like rheumatic fever, which can cause temporary nervous system disorder, scarlet fever, which causes bright red rash that looks and feels like sandpaper, a kidney infection, and sinusitis. You can check my video on sinusitis up here. The best way to prevent tonsillitis is through good hygiene, including washing hands often, especially before touching the nose or the mouth. Avoid sharing food, drinks, or utensils with anyone who is sick. Staying away from someone who has a sore throat or tonsillitis. Avoid sharing personal items like toothbrush, and replace your toothbrush regularly. When you notice your tonsils are inflamed, you need to seek medical help immediately or go to the hospital, so that a proper diagnosis can be made to determine whether it is viral or bacteria that is causing the inflammation. When tonsillitis is caused by a virus, the length of illness depends on the virus involved. Usually, complete recovery is made within 1 to 2 weeks. For bacterial tonsillitis, antibiotics needs to be given. But before you go to the hospital, the following may help. Drink warm or very cold fluids to help with the throat pain. Honey may also help. Gargle with warm salt water. Get lots of rest. Eat smooth foods like ice cream. Use a cool mist vaporizer or humidifier in your room if available. Suck on lozenges to numb the throat, and you can also take over-the-counter pain reliever for the pain. So guys, give me a thumbs up if you find this content helpful and useful. Kindly subscribe, click on the notification bell so you'll be the first to know when I upload new videos. If you have any questions or topics you want me to discuss, kindly drop in the comment section below and I will attend to them. I'm still your next door nurse and I'm just a knock away. I love you guys. See you in my next video.